have an immunological perspective in terms for breast cancer?
So, immunological perspective. So let me say with respect to most cancers are cells which differ morphologically and at the molecular level, even on the cell surface, from their normal counterpart. Definitely. So there would be either one can think in terms of neoantigens that come, or because of mutations, or they could be new antigen. Not new, but changed antigens which may also come in terms of, let's say, expression. So let's say on a normal breast cancer cells, you have very small numbers of gonadotropin releasing hormone receptors. They are so less in number that detection with antibodies is, you can't detect. However, in about say 30% of cancers, breast cancers, these GnRH receptors, gonadotropin releasing hormone receptors, they're overexpressed. So it would, of course there are these neoantigens because they are in very small numbers in normal cells. So immune cells should be able to recognize these as foreign, because the GnRH receptors you have are on the pituitary cells and also the placenta. So as such, it's not ubiquitously expressed. So it's possible. However, GnRH is not the best example, but what would be a good example would be these growth factor receptors such as HER2/neu. Yeah. So, and of course, as one knows already, that these are exploited for treatment. So you have antibodies that can bind to these receptors, and there's a curtailment of growth. So it's been a success story, but success story only with respect to a very small percentage of.
Yes.
So these antigens which are differentially expressed on breast cancer cells, that still needs to be studied.
The diversity of cancer and breast cancer is I think the limiting factor always for diagnosis and treatment in cancer.
But there are some, from the last 25 years, one thing is for sure, that all the clinics that can afford, or let me put it the other way around, that patients who can go to these clinics and to pay for those tests, I know include estrogen receptor positivity, progesterone receptor positivity, and others. So I know that diagnosis and treatment has come a long way. So it makes no sense giving antibodies to HER2/neu to those patients who do not have. So definitely they do the screening.
Yes.
So that way it's, things are much better. But yes, I do believe that immune system has a tremendous role to play, not only breast cancer progression, but also all cancers. Because it is known that, it's believed, there's an immunosurveillance, I think you've read enough about that to know that when there is a mutation and a pro-cancer cell comes into existence, the immune cells actually come, not only the acquired immune cells, but also the innate immune cells. They get activated and they in fact kill these cells. So that's the way I think we all have mutations all the time, and our immune system is in fact able to check even the development and establishment of tumors. Most of the time, it's only when there's some errors that happen, and therefore the cancer establishes itself. So I think immune system plays a great role, but the immune system has not been, or the study has not gone to a level where let's say one can think in terms of customized treatment, like maybe patient A has a particular antigen which on her breast cancer cell, but patient B does not, even though everything else looks the same. So, but how does one get to that? Which antigen? So it's a kind of